modern imaging to me is almost like a crystal ball.
Mhm.
So, I have that 35-year-old patient who's maybe crying in my chair. But what if I could have caught that patient at 5, right? That same patient.
Yes.
And we always sort of assume that the TM joints, which everyone has a left and right one, we always just sort of assume that those joints are healthy until like something goes wrong.
Yeah.
But a lot of times, as we're starting to do more imaging with those younger and younger pediatric patients, we're starting to realize that the anatomy is not normal. And whether it's that small compressed airway space, or maybe we're seeing, early degenerative changes in, kiddos as young as 7, 9, kind of like that pre-orthodontic condition. And so that's where the passion for educating kind of came in, is like, how can we do better by our patients? So not just the ones that are like already suffering and in pain, but how can we intervene in a way that's meaningful?
Hi, ladies. My guest today is Dr. Tiffany Lamberton. I'm super pumped to have a conversation with her. I just want to share her bio with you so you know a little bit of background on who she is. She holds dual degrees in physical therapy and dentistry, which I figured out is about 10 years of school. Count me out. I couldn't do that. Both from Loma Linda University. She is passionate about educating dentists and other healthcare professionals through her podcast, Jaw Talk with Dr. Tiffany, and her business, the TMD Collective. She has lectured for the Pacific Northwest Dental Convention and will be a featured speaker at the upcoming Western Ortho Conference in November. She is the treasurer for the Pierce County Dental Society and a member of the ADA, WSDA, and the Chicago Study Club. She lives with her husband, 2 kids, an adorable puppy, and loves wake surfing, snowboarding, and Pilates. So join me for the full conversation with Dr. Tiffany. Welcome to the 24th episode of the Story Project podcast. I am Joanna Scott, your host, and I'm so excited for this conversation today with a new friend of mine, Dr. Tiffany Lamberton. Welcome, Tiffany.
Thank you so much. I am just so honored to be on your podcast. I have been kind of fangirling you from afar on Instagram, just loved your style, everything that you're doing. And so I just feel very honored to be here. Thank you.
That's awesome. Well, I feel like you and I already have like synergy, just kind of based on some similarities in our brands, from what I can tell. But I was just telling Tiffany, it's so cool, the power of, social media and how it actually can bring us all together and the most amazing people that you meet along the way. And then you can actually really create authentic relationships with them. So I'm super pumped to get into your story. But before we do, I have a few kind of icebreaker fun questions I wanted to ask you. So, okay, first, I heard you were into wake surfing. This is so fascinating to me. Tell me, okay, what is wake surfing exactly? Because I'm a newbie when it comes to that. And then how did you get into it?
Yes. So with wake surfing, it's a little bit different than water skiing or wakeboarding. What you have is there are dedicated wake surfing boats that have ballast. So they fill up with water and kind of weight the boat down. And then it generates this giant wave. So you use a short rope to kind of pull up. And then the idea is to toss the rope into the boat and then just surf on the wave. And so there's, lots of different styles. There's skim style, there's surf style. Then, obviously like the pros are doing all these tricks like 360s and, all of these different things. So, how I got into it was, I grew up in Eastern Washington in a little tiny town, and my dad he was a dentist, or, retired now, but he, when I was 4 years old, he was like, you're going to learn how to water ski. I'm going to put you on my shoulders and then you're going to put your feet in there. So I grew up just trying everything, water skiing, knee boarding, tubing, barefooting. And, with some of those things, you can kind of bust up yourself pretty well if you fall.
Yeah.
Whereas like wake surfing, I feel like it's a little gentler on your body. So it's something that my husband and I got into, in 2020, I wake surfed in my Carolina Herrera wedding dress to commemorate our 20-year anniversary. And so everyone was kind of like cheering like all around the lake when I went around. So
I love that. Oh my gosh. I have like a visual of that. I'm sure you have some great photos or
I
video.
have some good videos. Yeah.
That's amazing. All right. What is your favorite way to unwind at the end of a week?
Yes. So fire pit, whether it's like solo stove or gas stove, we have one on the deck here. We have solo stove in the back. My puppy, I'm kind of obsessed with him. He's a little Cavapoo puppy. So getting him on my lap, a little glass of Chardonnay. I'm obsessed with Rombauer. We call it Mom Bauer because if mom has it, she's happy. And then just good conversation. So whether it's like just with my husband, we're talking about the week, or if we have friends over, I love that, So we have the privilege of a fantastic view where we live. I'm kind of a West Coast girl, so
Yeah,
West Coast is the best coast. So it's very like soothing for me to see water, whether it's like at the lake or, the ocean. It's very calming.
I love that. Okay. I'm going to come visit you very soon.
Okay, good. I want you to.
Okay. I love your fashion. So tell all of us, this is mostly women listening, but what's your favorite fashion kind of trend happening right now for women?
Yes. Well, I grew up in the age of like Jessica McClintock and Gunny Sack. And so the fact that like Love Shack Fancy, Zimmerman, like all these brands are bringing back the ruffles and the tulle skirts and like the Valentino ballet flats and like the pink. I'm here for the very like feminine florals. That's kind of my vibe. So
Love it. That's amazing. And like you can go to Anthropologie has been a really great spot lately. Oh my gosh.
I'm
There's
obsessed.
I literally am. I'm just like, sometimes I'm like, is this dress worth it? But they're really pretty and very flowy and just yeah, they have a lot of great styles there for sure.
Yes, and lots of like white eyelet, like kind of flowy dresses for summer, which
Yes.
I love that.
Yeah. Okay. So fun. Well, before we dive into the professional side of who you are, tell us where you're from, about your family. I know you have a really cute puppy and you've got some kiddos.
Yeah. So I live in Tacoma, Washington, which is kind of the greater Seattle area of Washington State. And I'm married to a urologist. I have two kiddos. They're both teenagers now. And so they're kind of like media averse right now. But, and then I also have a little Cavapoo puppy, Wookie, who I was never really a dog person, but we kind of got the pandemic puppy. And it is just like, so soothing to have an animal that just is like so excited to see you every day,
Yeah,
and he's just very like loving. So I'm obsessed with him.
I love that. We 2 years ago, we adopted or we got really, I mean, I guess you adopt all of them, but a mini golden doodle for my daughter. She, after years and years, since she was a baby, she prayed and cried and like it was like the top of her Santa list. And finally, we were just like, okay. And it took my husband and I like quite a while, like 9 years before we could have kids. So we already had our years with our golden retriever. And so we were like, our dog years, they're done. We had our time with him. He was wonderful. Nope. It's like round two, mini golden doodle. And man, does she have a lot of energy. But
Oh,
she's,
what's her name?
her name is Callie, but
Oh,
she's so sweet and adorable and just loves everyone. And she's brought a lot of joy. Both of my kids are teenagers as well. So she livens things up.
help too, or does it end up being you doing all the work?
So that's part of it. I mean, she knows I'm her alpha. She's imprinted on me. She knows I'm going to keep her alive. I take her to the vet. I make sure every morning, dishes are, cleaned out and she's got new food, new water, all that kind of stuff. Right. And getting groomed and all the things that come with dogs. But my daughter she's gotten way better with helping. So, and I kind of have really made it like a little bit of a non-negotiable. I'm like, you wanted this dog. So she gets 2 walks a day and that's your responsibility. And I mean, I'll walk her sometimes too, but you know what I mean? So I'm just getting her to the routine of like, this is you, this is good for you. It's just, learning learning how to be responsible and kind of take ownership of your choices, since you were the one that begged for the cute little dog. So
Totally, totally.
yeah,
That sounds so familiar. My son wrote us this like very convincing letter, like all of the reasons and like he was
yeah,
going to do all the things, but yeah, I'm doing most of them.
yes. I know. And then in the meantime, we're like, we're not bitter, no.
No, no, he's brought a lot of joy to me
Yeah.
personally.
Well, I want to give our audience a little background on you and then how you got into dentistry. So tell us just kind of the Cliff Notes version of who or what inspired you.
Yeah, so I mean, I come from kind of, I would say, like a very rich heritage of like family that were in healthcare. My granddad was one of the first physicians in our little town in like the 40s and 50s. Then my dad was a dentist, and he, went away to dental school, did some, mission dentistry. So fun fact, I was born in Taiwan, actually, because he was doing mission work there. And then, my family moved back to, his hometown, which is this little tiny town in Eastern Washington. And so I grew up there and just kind of grew up in my dad's office. Used to have these like terrible jobs of like punching rubber bands to make like the little stoppers for like, endophiles, and like separating the articulating paper and like the study models and weeding at the office outside. So, but I at the time, my family, really wanted, I would say with our sort of a background was just, it was very much about like, you should be in healthcare. This is a way for service. You can give back to your community. But it was like, try hard, but don't try too hard. So, it was like, well, maybe you could go into dental hygiene, but not a dentist. So at the time I had a cousin who is a physical therapist. And so I went out and shadowed her, and I was like, ooh, physical therapy seems like a really cool pathway for me. So got my degree in physical therapy, loved it. I was working here kind of in the Seattle area. We had just an amazing practice that I was part of. I had a mentor. We were seeing, some of the Mariners, some like the pro tennis players, just had like a really great job. And then my husband ended up getting into medical school back in Southern California. And so we ended up getting married between his first and second year of medical school. And kind of during that time, I just felt really lost, kind of going back to California, kind of was like, couldn't find the same job opportunity that brought me as much passion. And I'm looking around to everyone at Loma Linda, and I'm like, I think I want to go to dental school. Everyone was like, why?
So how many years had you, so physical therapy, how many years of school was that?
Well, you're going to really date me, which I'm 51. So
Yeah.
I got my master's in physical therapy. I practiced as a physical therapist for 7 years. And so then like moved back to Loma Linda in like 2001. And so was working, started taking prereqs, got into dental school in 2003, and then graduated in 2007. So
Okay. So, so was that 4 additional years for
for
your,
dental school
yeah,
or
for
for
dental
physical
school?
therapy. Yeah, dental school was 4 years at Loma
Okay.
Linda.
So,
Yeah.
so then you did, well, I'm terrible at math. So you did 6, so 10, right?
It was a lot of school.
Oh my gosh.
Paying for it.
Oh my gosh. I'm just so impressed by that. 10 years. Okay. Bravo. I mean, that's, and way
Thank
to
you.
pivot and kind of go like, okay, this might not, currently be my passion. And you just moved towards something that you felt might be. So I think I don't know, I applaud you for that. That's amazing.
Oh, thank you. I know. I tell people I think I'm kind of a unicorn, and I have dual degrees in both physical therapy and dentistry, because I just don't think there's probably that many people out there that have both of those.
Yeah.
So
Yeah.
what that's kind of led me towards is kind of more of like this interdisciplinary approach of, when you're in dental school, you do your anatomy and you do all these things, but then like you get up in the clinic and it's all about the teeth and all about restorative. And you kind of forget that bigger picture of like, oh, what's going on with the cervical spine, or like what's going on posturally, or like what's going on with, kind of that more like how can we work together in an interdisciplinary team with our colleagues on the medical side of things, and so long story short of, kind of coming to TMD Collective, which is, kind of has two parts to it. One is my practice of seeing TMD patients. The other part of it is, the educational platform is just really kind of helping dentists and other healthcare providers like PTs, SLPs, myofunctional therapists, a lot of airway dentists are starting to like understand better that we need to understand more about the skeleton and more about, kind of this complete picture of our patients rather than just the teeth. And so that's where I try to kind of have, leveraged my dual degrees is like, I kind of have like a unique perspective on things. So.
That's amazing. So do you own your practice in Tacoma? Is it or is it a partnership? Do you work in multiple practices? Because I wasn't entirely sure.
Yeah, I work out of 3 locations.
Okay.
I kind of bill myself as like a mobile practitioner, trying to kind of
Yeah.
like cover an area. I'm not a high volume practice. I'm fee for service, and so that's can be sometimes difficult for people. But I've kind of done the high volume practice, and that wasn't me. Kind of done a lot of different types of practices, and just really wanted to kind of like start to kind of phase out of the restorative piece of it and more into kind of like a holistic model.
I love that. That's awesome. So do you have a specific demographic that you focus on, as far as like kiddos, or is it really any?
Yeah, I would say a lot of my practice right now are it's females because women tend to have problems with their jaw joints more than men.
Yeah.
I would say kind of like that 30 to 35
Okay.
demographic. Um, but I'm passionate about educating for early recognition. So, and that's the piece of it. So like, I don't see a lot of young kiddos right now in my practice because I'm kind of seeing like the aftermath, right? Of
Yeah.
like, oh, you had ortho and
Yeah.
then you had some restorative work done and then your jaw locked closed and you can only open like 5 millimeters. So
Yeah.
like, and then you look at their imaging and you're like, oh, your condyles look trashed. Oh no,
Right. Right.
And so I think what's frustrating for patients is like, why didn't anyone recognize this? And
Mhm.
so, I think we're going to segue into this a little bit more too. But for me, modern imaging and digital dentistry and the technology that we have right now that's really rapidly expanding is allowing us almost like a crystal ball of like, instead of, sorry, I need to turn my phone. Whoops, edit that out.
We love
Um,
we love
so
bloopers.
yeah, so modern imaging to me is almost like a crystal ball.
Mhm.
So, I have that 35-year-old patient who's maybe crying in my chair. But what if I could have caught that patient at 5, right? That same patient.
Yes.
And you always sort of assume that the TM joints, which everyone has a left and right one, we always just sort of assume that those joints are healthy until like something goes wrong.
Yeah.
But a lot of times, as we're starting to do more imaging with those younger and younger pediatric patients, we're starting to realize that the anatomy is not normal. And whether it's that small compressed airway space, or maybe we're seeing, early degenerative changes in, kiddos as young as 7, 9, kind of like that pre-orthodontic condition. And so that's where the passion for educating kind of came in, is like, how can we do better by our patients? So not just the ones that are like already suffering and in pain, but how can we intervene in a way that's meaningful? Kind of like sleep apnea, right? So we have a lot of those patients that are older, that have all these risk factors that we can, we can look in their back of the throat, we look at their, tonsils and things like that, and we can see, oh, wow, you have this major health condition that's affecting your overall health. What if we could again then, go back to that pediatric patient and recognize, there's some of those risk factors in the skeleton that are telling a story.
Yeah.
And if we can change kind of the trajectory of those young kiddos' lives. And so I love that there's a lot of organizations, ASAP Pathway, it's, a lot of very pro, like let's look at kiddos and their airways early on in life. But my little piece of that niche is it's not just airway, it's also the growth and the development of both the maxilla and the mandible. And if those things aren't happening, even if we just fix the teeth, there may be some deficiencies, in the joints themselves that we need to make sure that we recognize before we do that treatment plan.
Yeah. Wow. Okay. So this is so fascinating to me, and it has been for years, but I I wanted to share this really briefly with you. I have my own kind of like personal journey with TMJ and like all of this stuff that started, I don't know, probably about 5 or 6 years ago. And I had spent years of like clenching my jaw, sleepless nights, shooting pain, like, just through my face. And it actually started to affect my like ability to speak. Like I would like, it would almost be like I would just have laryngitis. I've never dealt with that in my entire life, but the pain was getting so bad, it was affecting my vocal cords somehow. And I remember, I was working for this nonprofit at the time, and I was supposed to be directing this really, it was like a reading buddies event, with all the mentors and their students. And I'm supposed to be, projecting loud so everybody can hear. And I had to have somebody else step in because my voice just gave out. And I remember going, this isn't right. I can't continue living like this. I felt like so out of control and just like so inhibited, it was just like, this is just such a mess. And the pain became like emotional too, which I think is a whole nother aspect, when you deal with that chronic pain all the time. Thankfully, I found a more of a holistic, ortho practice that I could work with. And I did go through, finding out my airway was really small, and like I was super narrow, like you were talking about, narrow jaw for females is super common, and it just kept like caving in on me. So I've been on quite a journey, myofunctional therapy, ortho, like all the treatments. Thankfully, I have my braces off now, which is nice. But what is interesting, I wanted to just kind of pick your brain on, is I didn't move forward with veneers.
Mm.
And if I'm being honest, I just felt, this is me being pretty vulnerable, but I felt really nervous. I said, what if something changes again with my jaw? And then I go and do full restorative, and then what? I felt like I was going to be stuck.
Mhm.
And to me, not living with jaw pain and making sure that in the, like, let's say in the future, if I need to make any kind of adjustments, I can. And obviously this is your world, your space. I'm not the expert, but I paused that and I didn't go forward with veneers. And I was like, you know what, my teeth aren't, they're still great. It's a, they're not perfect. I know if I got veneers, they would be like, the perfect teeth, but I just wondered what your opinion is on that. And if you find that among, all of the women that you're working with.
I do. And I think that that's where modern imaging can be really useful. So like, for example, an MRI of your TM joints, if it's done the right way, you can find out exactly where that little articular disc is, whether it's kind of cushioning and protecting the mandibular condyle, or if it's moved off, either like off to one side or the other. And I think that that's where that can give you a lot of information on whether the TM joints are predicted to be stable. Because what I found is, as I started to image more and more of my patients, so yes, cone beam CT is going to give us a lot of information about the hard tissue, but an MRI is going to give us a lot of information about the soft tissue. And so a lot of times, if the disc is partially dislocated, and then depending on what you're doing, maybe you're bringing the jaw forward, with a mandibular advancement device, or maybe you're changing the loading on the joint with a splint, or maybe you're changing the bite with a full mouth rehab. What I feel like the MRI can really tell us is the condition of the joints, the condition of the disc, and if there's active breakdown. So there's one series in particular. So the proton density is going to show the disc, and then there's a stir series that's going to show the fluid in the joints. And so if that joint is a hot joint, where there's just active breakdown, I've seen a joint be loaded incorrectly by an appliance that broke down the bone in like 9 months. And so, no matter what treatment we're proposing as dentists, whether it's a splint or orthotic or orthodontic therapy, clear retainers, surgery, veneers, restorative work, I feel like as general dentists, we need to understand the condition of not just the teeth with our, all of our, x-rays and, CBCT, but also the joints and the airway themselves as well. And the more we start to image, the more, I mean, that's hard data that you see, a CBCT is going to show like a moment in time, but with the MRI, doing that in different, positions of like, let's say you're going to build the bite forward, you want to know that those joints are protected and stable in those joints. And if the disc is dislocated, are those joints relatively stable, and can they withstand those changes of, going through the whole veneer treatment? So I feel like one of the things I preach is comprehensive exam plus modern imaging. Does every patient get imaging? Of course not. I mean, like we have to be good at recognizing what are the signs and symptoms. But I think too often as dentists, we just want to jump into that big treatment. We want to jump into that smile transformation, and we're not taking into account, can the skeleton actually support the changes that I'm trying to do for this patient? I mean, I could tell you like story after story of, patients that have had orthodontic surgery, orthodontic, all of these things to try to change the relationship, but they may or may not be able to support that new position. And so it's not that that was like a bad practitioner. It was just that like, now that we have these things at our fingertips, let's do better. And then let's get that comprehensive diagnosis before we jump into any type of treatment. And I think that's where patients get really frustrated that have TMJ or TMD, because, they may go into like a guru and they're like, okay, for $8,000, I'm going to make this TMJ orthotic for you, and it's going to change all of your pain. It's going to take it all away.
Yeah.
Not do the full imaging workup, or not really understand all of the systems. And then the patient, again, there's always like a risk benefit discussion, right? No matter what you do, whether it's, taking a certain type of medication, Botox, a lot of people are like, want to bag on Botox. Do I use Botox? Sometimes. Does it work all the time? No. Are there risk benefits with it? Yes. So I think when we talk about like our toolbox and what we have available to us, I think it's really helpful for the patient to also own their anatomy. So in your case, before you jumped into, a $40,000 veneer change, I think it's beneficial for you to like pump the brakes. Let's look at everything, go through that muscle palpation. Let's look at your C-spine. Let's look at your range of motion. Let's look at your bite. How do your excursives look? And then let's look at the imaging. Let's look at, hard tissue, soft tissue, and can your skeleton and your musculoskeletal system sustain this proposed treatment? So I think we get so fast into just like wanting to jump into treatment. Like, yes, I'm going to like transform your smile. And I mean, I get that because like I want veneers, but I had an MRI and both of my discs are completely dislocated. I'm like, okay, well, can I live off the disc and be relatively stable? Do I need surgery? There's risks and benefits with that. Do I need a joint replacement? No. So I think that's where, patients have already heard, oh, don't do TMJ surgery. It's so bad. I think that piece of it just kind of had its own set of problems. But I think as general dentists, we need to be kind of like the air traffic controllers. So we need to be the one that's ordering the imaging and then working together with the PT and with the orthodontist and the oral surgeon and the periodontist and really just directing, here's where we want to go. Can the skeletal system support this new position? Because I think unfortunately, people jump into like clear retainers and changing their bite, and then all of a sudden their joints weren't healthy to begin with, and then they start clicking and popping and locking, and then going down kind of like a spiral of like you said, where you felt like you couldn't even swallow or
Right,
speak or do some of these basic functions that we do all day long,
right.
and we need our jaw joints to be healthy and function at.
Yeah,
But then it looks like in the patient's mind, if you put in this $8,000 orthotic and then they're not better or they get worse, then it's your fault.
yeah,
So I
yeah,
like to, really just approach it like, I want, here's what I found from my exam. I want to find out more. Maybe that means a sleep study, maybe that means an ENT assessment, maybe that means more imaging. And then here are the treatment options that are available for you. And you get to choose that, because it's not me choosing your treatment. It's you choosing your treatment based on your
yeah,
anatomy.
yeah. I love
Um,
that so much because I think it's so important to customize it per person. And I was interested though, I don't hear too many dentists though talk about MRI imaging. How how do you do that? Do you send, obviously an MRI, if you had an MRI machine, I'm sure those things are, I can't imagine the cost and investment. So do you send people offsite to imaging centers, the hospital, or how does that work?
I do. So right now, I have a couple different imaging centers that I work with, and I've gone and trained, both the techs, because there's a specific protocol of how I want the patient imaged. And so, I'm so lucky. I have an amazing neuroradiologist in my area who's, published, he's been doing this. And so I was like, I want this, this, and this. And he's like, of course. So I'm really lucky, but that's part of like being in TMD Collective is we help you with the protocol, right? And so we help you have that conversation with the imaging center in your area.
Right.
I've been so lucky. I'm part of a Chicago study club. Shout out to my mentor, Dr. Jim McKee, Dr. Drew McDonald. Some of those guys in that study club have helped all of us, kind of general dentists work with an imaging center in your area, because that is a barrier for people. I am really excited. I just was reading that Dentsply Sirona has teamed up with Siemens Healthcare, and they're going to be doing more of like a dentally based MRI machine, which I'm like, yes. Like,
Oh, it's amazing.
so that's why I get super excited about digital dentistry, as we start to, see more and more of the anatomy with like VR and, intraoral scanning and CBCT and all of these tools that we have at our fingertips. Then we can put that all together, and it's for the benefit of the patient, that like our workflow is quicker, they can get diagnosed faster, it's not such a barrier.
Yeah. I do have to ask you again, partly this is selfish, but I'm so curious on the early detection and evaluation of children, especially, my daughter she's 14. She has definitely gone, and we've had her evaluated, by an amazing ortho practice here. And she does have like a sleep, orthotic that she wears at night to help her not do mouth breathing and all of that. However, and since she doesn't listen to these podcasts, I'll be okay. I can share this.
Would
she's
she be mortified that you're talking about her?
she literally would be. So I'll do it really, really quietly here. But I'm concerned like currently with just the increase in fatigue I've seen with her and how much she wants to sleep. So, I took her to our family, doctor today, and just going to run just a normal panel just to make sure everything's okay. I feel like that's due diligence as a mom, check for anemia, check for, blood sugar levels, like all that kind of stuff. But also that when I just don't think that kids should, I mean, unless she's growing, it's just hormones, which I realize that could be a whole thing. She's sleeping and wanting to sleep so much, it just makes me think that she's not getting proper oxygen at night.
And then like when you look at her profile, is she very like retrognathic or like class 2, any like anterior open bite or like Has she had any, um,
They said that she didn't need, like traditional ortho or Invisalign or, braces, whatever. So she has she grew up sucking her thumb. So that was a whole thing. And I remember like even as a
yeah.
toddler, I was like, oh my goodness. So, but thankfully it all went back. I mean, it was like a miracle. So her teeth are actually in really good shape.
Okay. I would say just, again, like utilizing, kind of all of those things as a dentist. We're looking at like profile with like the clinical photos. And there are certain things of like facial asymmetry. So like if she has like one side, that maybe is like the chin is going towards one way. So I'm going to give you an example. We're talking about kids.
Yeah.
So one of my kiddos, he had like several falls early in life, like 3 years old, like fell in the bathtub, fell on his chin, like in kindergarten, fell on the playground, concussion. A month later, like fell again, and I just started to be worried. And I mean, I'm crazy enough that I've taken him to 5 different orthodontists. I'm like, I don't like his growth,
Yeah.
and they're
Yeah.
he's fine, he's fine, sleep study. He was having, sorry, I might start crying. Like so many events an hour,
Hmm.
that were affecting so many things, and so I'm like, here I'm a dentist. I know all of this stuff, and we have to pay attention to the bigger picture. So I would say a sleep study in the lab, even though it was like torture to go through, it was so helpful for me to actually just see those numbers. And then just working, with the CBCT, you're going to see both the nasopharyngeal airway space. Is there a deviated septum? What do the tonsils and adenoids look like? What's the oropharyngeal airway space? And as dentists, that's the space that we can make the most impact. So if growth isn't happening with the mandible, if it's not growing, down and forward, or it's growing asymmetrically, maybe one side isn't growing compared to the other, to me, those are some red flags that we need to dive a little bit deeper into our imaging. And so for my kiddo, we went through the imaging, and I will tell you, having your kid go have an MRI of their DM joints was really, really hard. And I knew all of the protocol. The first time we tried it, he panicked, and both of us burst into tears. I felt like, am I being like the worst mom ever? But then we tried it again, and we were able to get that imaging. And what we found was that on the short side, the asymmetric side, his disc was dislocated out of position in when he bit his teeth together in MIP, or maximum intercuspation. That disc wasn't where it was supposed to be. It wasn't protecting his growth center. But if we pulled him forward, it did go back under position there. And so I think that is the key piece of it, is if we have these young kiddos that still haven't completed their growth, for girls, they're going to be done growing by 15. So we have kind of a shorter time frame, kind of like that 12 to 15 when they're like going through puberty. With boys, we have a little bit more time where they're going through growth. But we know from the literature that like 85% of like the growth of the mandible and the maxilla is done by, like age 8 and age 5. Sorry, edit that out.
Yeah.
um, but yeah, again, I think that, with your daughter, going back to that is, really kind of doing that due diligence of that, bringing in those interdisciplinary people of like a sleep physician, getting the imaging, where is she at? She's almost 15. And so, really paying attention to, what does her bite look like? Is it staying relatively stable, or is it changing? Because I think that when the joints are actively going through that breakdown, like we were talking about, you're going to start to see that progressive class 2 shift and that anterior open bite, or you may see it one side, or you could see both sides. And so that goes back to the imaging giving us that crystal ball and that story of whether the joints and the skeleton and the whole body are, are they supporting our overall health. And so, I feel so passionate about as dentists, we need to be better at this, because I think we don't get a lot of this in dental school. At least I feel like I didn't get enough of it. And so, kind of that interdisciplinary approach where we're working together in teams. I think of like an extreme situation of like, a good friend of mine is a cleft and craniofacial orthodontist. And, so if you have a severe, issue with the skeleton, as a dentist, you can't do that on your own, right?
Right.
You need that system of people that are like giving input, and so I think that we need to be able to be in a situation where we can provide that type of comprehensive care to all of our patients. And unfortunately, we're not there because, like you said, an MRI is very expensive. It's very, cost prohibitive to some people. It's difficult sometimes for the patients to go through.
Yeah.
But as we start to break down those barriers, we're going to get better and better at our diagnosis. And then that's going to, change our treatment plans with our patients.
This is such a side note, but do all of the MRIs, because I've only done personally a breast MRI. So I was just curious, do they all have that crazy loud clicking sound? That's just,
Yes.
okay. Well, let's
Yeah.
hope that
And
Dentsply Corona.
some centers will give you ear, things, or you can watch a movie. Every imaging center is a little bit different, but yeah, I've done one for my neck. I've done one for my TM joints. It's not it's not fun.
It's not the most pleasant experience. Oh,
Yeah.
man. I think when I had it done, I thought it was going to be just a cakewalk. And I was like, oh, this is going to be nothing like a mammogram because you're not getting smashed or whatever. But then it's just you
It's
know,
very loud.
oh yeah, the
All the
sensory
different
experience.
sequences. Yeah, it's scary.
Yeah.
Yeah. Yeah.
Okay,
So
well,
again, the more we can work with the imaging center to get, especially in younger kiddos, to have a series done that's quicker, that prepares them, there are different things that we can do. Obviously there's, medication that you can take to kind of help
yeah.
relax the patient as well. And so there are other like strategies, but yeah, it can be definitely a barrier for multiple reasons.
Well, I definitely want to talk about your event that's coming up. But before we do that, do you have just a short patient story that maybe comes to mind that just warms your heart that you've, been able to be a part of their journey and really help them change their health, their wellness, their life?
Yeah, absolutely. And I've been in a situation, like I said, with a national study club where I have other amazing restorative dentists all over the country, amazing orthodontists. Dr. Drew McDonald is an orthodontist who is now in St. Petersburg, Florida. He's working with an oral surgeon, Dr. Brian Shaw, who's absolutely revolutionizing modern TM joint surgery. And so being able to, I had a patient, she had come to me here in Tacoma, and she was having just like such horrible clicking and popping where her disc was popping on and off every time, she was, using her jaw, chewing, all of those things. And, we talked about from the very beginning, like, let's get all of the information. She did some Botox with me, but I told her, I was like, this is not a cure. This is just kind of a Band-Aid to try to help with some of your muscle myalgia. But what I would like you to do is to explore some of these other options. And so she ended up flying down to see Dr. Shaw in Florida. He ended up doing autologous fat graft surgery on her TM joints. And then she ended up having restorative work to fix that after. So she was in a splint for 9 months and then did some, restorative work to fix her bite after that. And I mean, talk about transformative. All of her pain went away. She was breaking teeth, her bite was breaking down. So all of a sudden, you always think again about like, oh, TM joint surgery, it's so scary. I could never do that. Why are you even offering that to patients? But again, everyone has to make that decision for themselves. And so I'm very clear with my patients. here are the conservative options. You know, this is what I have in my toolkit. This is what I can offer you. Here are the orthodontic, you know, toolbox. Here's, you know, a surgical, you know, toolbox. And that patient has to make that decision. But she's come back, and because she was like, I can't live like this. You know, she was, I think 37 to 40, somewhere in there. And I mean, she's done amazing. And so,
Wow.
you know, I don't get any financial incentive for like referring
Yeah.
to anybody. I just want, you know, I like, if you come to me as a patient, it's like you're my family member, you know, and I'm so passionate about, you know, giving patients the options, and then they're going to have to decide that for themselves. You know, people finance stuff all the time. They finance a house,
Yeah.
finance a car. You know,
Yeah.
could they finance a surgery? You don't know. It's not your decision. And so what I try to do is just educate people. This is what my experience has been, that these are the network of people, you know. So I try to pay attention to like what everybody in the TMD world is, you know, what they're preaching and what they're talking about. And I try to kind of put my arms around everybody. Like, I'm kind of a linker, like, let's all get along, rather than being like, oh, I'm in this camp, or I'm in that camp, or like, I learned from this guru, or I learned from that guru. To me, it's like, let's all learn from each other for the benefit of the patient.
Yeah. I love that. You're a linker. I mean, it's like,
I'm a linker.
that's so incredible. I think that we're stronger if we move forward together. And like you said, learn together, grow together. That's
Collaborate together.
totally. Yeah. Okay. We'll take a minute. And before we wrap up, I've heard that you have this incredible event for women coming up. And can you just tell us more about it? I think it's in September.
It is.
Okay.
So September 6 and 7, this is kind of our first, like, and again, in the future, I'm going to need a rebrand because I picked too long of a name. It's Interdisciplinary Perspectives Uniting Women in Dentistry, IPUWD. Again, you need like a quicker name that can like go on like the hats and the tote bags and all.
Right.
So I'm going to need you in the
Okay.
future when I do this like every year.
Yeah.
But this is my first one. But what I wanted was, I want the general dentist. I want the orthodontist. I want the periodontist. I want the pediatric dentist. I want women in dentistry to come together, to stay humble, stay curious, but also build each other up, and to create just a collective of where we can share our experiences. And, you know, I'm not an expert at everything. So, you know, I have Dr. Lynn Thomas, who is just an amazing dentist. She was just on my Jaw Talk podcast this week. And she knows so much about digital dentistry and occlusion, and has just done all of these things. And so if I don't know the answer, someone else in my speaker, you know, pool can answer it. So we have an amazing group of speakers. Like I said, we have a cleft and craniofacial orthodontist. We have an oral maxillofacial radiologist, Dr. Satara Lavasani. We have, you know, just a really beautiful group of women that are just so accomplished, that are going to come and they're going to share both clinical and also personal things too, about like women empowerment and leadership. Like, how do you do pitch negotiation? How do you do this? How do you do that? So no more boring CE. This is a chance to come and get your questions answered. And we're doing Pilates, and we're doing a private shopping event. So I also wanted to like showcase some of my favorite Tacoma businesses. So like, I love like unique jewelry. So Lapis Tacoma is like right here by my house. They're giving us a private shopping event. So it's this beautiful little boutique where you can shop gifts and jewelry if you don't want to do Pilates. We're going to have wine tasting. We're going to have a gala event. We have amazing sponsors. So please, all you women in dentistry, sign up. It's going to be an incredible experience. Seattle is a quick flight. Tacoma is just a couple, like 20 minutes south of SeaTac. The hotel that we're at is called the Silver Cloud Point Reston. It's right on the water, overlooking the ocean. It's like 77 degrees and
Wow.
beautiful blue
Oh,
skies right now. So the hotel is amazing. I think it's just going to be like a really unique experience. So
when is it again?
September 6 and 7.
Okay. Okay, awesome. September 6th and 7th, audience. So
Yeah.
that's amazing. Now, how can people sign up and also follow you on social media?
Yes. So if you go to tmdcollective.com/IPUWD, that will give you all of the information about all the different things, and also the link to get your tickets. So don't delay. The Silver Cloud is filling up. It's like such a popular place right now. I don't know if you saw my reel, but I did like a little reel.
Yes,
Just
you did. Good job. I loved it. Yeah.
I'm trying.
Yeah, you're doing
Um,
amazing.
but yeah, we're doing a little, and then I did a little campaign at Lapis where we went in, and I was just like showing off all my, favorite things. So we've got Lapis, we've got Pilates, we've got wine tasting, and lots of fun opportunities to grow both professionally, but also just really like empower and encourage each other because it's not easy. I think about like when I, had my first kiddo and I was trying to like breastfeed in between patients and like pump in the
Yeah.
bathroom. And, I mean, like, I think we're unique in that a lot of times we're juggling roles of not just our professional career, but also caregiving, and all of these things. And you really just you need your people, you need your collective to rely on to help you through all of those different seasons of life. So
I couldn't agree more. Oh my goodness. We all need our collective. I was just talking with I doing like an interview with a potential candidate for Studio 88, and she's a new mama, and we were we were just talking about how they're always a part of you, your kids, and you literally, it's like you have this part of your brain that's ambitious and it wants to pursue your calling, right? And what you're meant to do. And then you have this other part that's your children and you give birth to them. So there's just a connection there that
yes.
even fathers, even wonderful fathers can't quite identify with. It's just different. And so I think that creating events like what you're doing for women to come together, regardless of the ages of their children or whether they're a GP or an ortho, I mean, there's so many commonalities and so many reasons where what just sounds like a beautiful community, that's going to be full of people probably swapping stories, and there's going to be a lot of empathy and a lot of encouragement there. So bravo. I'm super excited for your first event, and I hope it's like smashing success.
Well, would just like really just so much appreciate, you sharing it on your network. I know you're part of Do and Dr. Ann Duffy. I had Dr. David Rice on my podcast and he was like, you need to meet Ann Duffy.
Yes, you absolutely do. In fact, if you should definitely, well, the Do retreat is happening in November. I don't know if yeah, but I would check that out. And I could send you all the details, but I try to recruit as many wonderful women in dentistry to go because it's just a really, really wide network of fabulous entrepreneurial type women. So
I love that. Well, and I think that there's just like enough pieces of the pie because, I mean, like there's always like a weekend that you're like, oh shoot, that's my birthday weekend, or oh shoot, I'm in Hawaii, or, but so there's always like, it's great to hear about like what other people are doing that are kind of like a similar, mindset and similar goals. So I love that.
yes. Well, thank you so much, Dr. Tiffany Lamberton, for just taking the time and sharing your story, your expertise with us today on the Story Project podcast. And yeah, I just appreciate you being here so much.
Thank you so much for having me.
So everybody, if you enjoyed this episode, be sure to subscribe and leave a review if you like. And definitely check out the tmdcollective.com. I think I got that right. Is that right, Tiffany? Okay. And you can just follow her as well. Follow her on Instagram. She's super fun and engaging. She's a wonderful human and she has really cool fashion too. So
thank you.
All right. Awesome. Well, we will see you ladies next time. And thanks, Tiffany.
Thank you so much.